I had a patient who presented with chest pains suggestive of a heart attack. He presented with severe chest pains, and that was associated with changes on the electrocardiogram, which is the heart tracing done when the patient comes to the emergency department. There were changes there, what we would describe as STD elevation suggestive of myocardial infarction or heart attack. Now, what was interesting about this case was this patient with a suspected heart attack was taken into the cath lab where I did an emergency angiogram for him. And actually, we found no blockages at all. This is an unusual but not a rare presentation of a condition called MINOCA. MINOCA stands for myocardial infarction with non-obstructive coronary artery disease. This basically is a condition where someone presents with symptoms mimicking that of a heart attack, but subsequently was found not to have one. The commonest cause of a heart attack, obviously, in most people is due to an obstruction or blockage in the coronary arteries. In these patients with MINOCA, what we find is that the coronary arteries on angiography will be normal, meaning we don't see any obstruction to the blood flow to the coronary arteries. This condition is not common, but having said that, it's not an unusual presentation, and we do see that about 5 to 10% of our patients who present with a heart attack. So not everyone that presents with a heart attack actually presents with a coronary blockage. 5 to 10% of people do present with symptoms mimicking that of a heart attack, but actually on subsequent angiography has been found to have normal coronaries. Among the commonest causes for MINOCA includes coronary vasospasm, which is a condition where the vessels go into spasm, hence the blood flow to the heart is reduced because of the vessels going into vasospasm. Another common cause would be, of course, microvascular disease. So this is a disease affecting the smaller branches of the coronary arteries, and that is not seen when we inject the dye down the coronary arteries. So the big vessels in the coronary arteries are actually patent, but there is endothelial dysfunction or microvascular disease affecting the smaller capillaries. Another common cause for MINOCA that's been increasingly recognized is a condition caused by plaque disruption. This is damage done to the atherosclerotic plaque, where the plaque ruptures or there's disruption and ulceration that may not be picked up on the routine coronary angiography, but has been detected on either intravascular ultrasound or by optical computed tomography, OCT.
Well, thank you for watching. I hope you liked the video. If you do, please don't forget to like, share, and comment. Thank you.